Namaste, my name is Dr. Swaraj, and I'm thrilled to be joining you today. I wanted to share with you a personal story about One Heart's maternal helpline program that has been established since we started our COVID response efforts in Nepal in March. In July this year, a young soon-to-be mother named Sunita Thokar had a medical emergency. Sunita comes from the remote village of Gokule in the Mahabharat mountain range. People marry young in Gokule, and compared to other regions in Nepal, school dropouts for women are very high. Last year, 2 teens became mothers at the ages of 15 and 16. The average age for a woman's first childbirth is only 19. 2 weeks past the due date of her delivery, Sunita wanted to go to the birthing center for a checkup. Since 4 that morning, Sunita was experiencing deep pain, which only worsened with time. However, most of the people in her village, including her family members, thought that visiting the birthing center was not necessary. After all, delivering at a birthing center was not the village norm, and her mother had delivered all of her children at home. The COVID-19 nationwide lockdown only added unto their reasoning that Sunita should stay back and deliver at the house. Despite their protests, Sunita made a phone call to the birthing center later that morning and was instructed by auxiliary nurse midwife Mandira Baidye to come to the center immediately. Mandira and Sunita were in touch before the pandemic, but in the middle of the crisis, Sunita had lost Mandira's number and had been difficult to get a hold of since. Following Mandira's orders, Sunita and her husband Bikash left on foot for the birthing center, a 2.5-hour journey from their home. It was around 2 p.m. when Sunita finally reached the birthing center. Mandira immediately got to work by examining Sunita's vital signs. Sunita was short of breath after a grueling trek, and she had alarmingly high blood pressure. Mandira's assistant nurse started intravenous saline, brought Sunita's body temperature down, gave her glucose water and soup, and kept monitoring Sunita's blood pressure every half an hour. However, Sunita's blood pressure level and her baby's fetal heart rate showed fluctuating results and never came to a normal level. Mandira realized that there was no way she could save the lives of both the mother and child with the expertise and resources she had at her disposal. Mandira made several calls to get supervision from the experts, including her mentors from her skilled birth attendant training. She made her first call to Dr. Anjana Karki, one of the doctors on One Heart's maternity helpline roster. One Heart launched the maternity helpline program focusing on the COVID-19 pandemic in order to help nurses working in the remote villages of Nepal connect with doctors during emergencies. The roster consists of doctors, 1 general practitioner working at the district hospitals in all of One Heart's working districts, 44 reputed gynecologists from Nepal Society of Obstetricians and Gynecologists, including myself. The program focuses on providing essential care to mothers at health facilities during the pandemic, providing clinical and psychological counseling to expecting women and new mothers, and providing relevant information to medical staff, especially on things like the provision of airlifts in extreme circumstances and management of complications if there is no possibility of emergency evacuation. Dr. Anjana took a detailed account of Sunita's health and instructed Mandira to measure Sunita's blood pressure and protein levels for preeclampsia, which can be fatal if not treated in time. Though Mandira did not have any means to test for preeclampsia, her doubts weighed heavily towards the positive side based on Sunita's signs and symptoms. Dr. Anjana advised Mandira to make provisions for rescue as soon as possible. Sunita was starting to bleed from inside by this time. It was already concluded that rescuing her via road was out of option due to weather conditions, and it would take more than 12 hours to reach to a referral center. Mandira reached out to Robin, One Heart Nepal staff, who had oriented local authorities on One Heart's maternal helpline program only 5 days before. Robin immediately called the senior health administrator at the district health office in the closest district to Sunita's village. and then called One Heart's executive director Surya Bhatta to report to him on the situation. That was when Surya first made a call to me to help Mandira and her team to stabilize Sunita's condition before the rescue was possible. Surya then started making calls to government officials, local authorities, and provincial and central government ministers requesting a rescue helicopter. One Heart doesn't have resources in our program for air rescue. We strengthen government programs by forming a partnership with the government, but we do not create a parallel system to the government. So, One Heart first contacted the provincial government to seek arrangements before taking matter into our own hands and rescuing her using a private helicopter. Everything worked out well and we were able to rescue Sunita on time. The whole team exchanged numerous calls back and forth throughout the night to coordinate for the rescue. I stayed in contact with the Gokuli medical staff all the while. After learning that Sunita's blood pressure was not coming under normal levels even after administration of 4 doses of nifedipine and with an unavailability of test and only one type medicine at disposal, I advised Mandira to inject Sunita with magnesium sulfate. Mandira could not muster the courage to inject Sunita, fearing that she would not be able to manage if the drug had side effects, but she administered the drug through the muscles after I encouraged her and gave her the confidence to do so. Though the team had been trying for Sunita's rescue since 4 in the morning and everything was finalized by 8 am, the helicopter could not reach the village around noon due to unfavorable weather conditions. Sunita was picked up by an ambulance from Kathmandu airport and was admitted to the emergency ward of Paropkar Maternity and Women's Hospital at 1 pm. The baby had ingested thick meconium and Sunita had a low platelet count. The medical team did surgery immediately using a method to control for postpartum hemorrhage, and Sunita was kept under observation in the maternal intensive care unit after delivery. Sunita gave birth to a healthy baby boy weighing 6.2 pounds. We are so grateful for this success story and are thrilled that Sunita and her baby have gotten the opportunity to live as a family with their loving husband and father Vikas. This story about Sunita is just one story of many that shows that it truly does take a village to ensure access to safe deliveries for mothers and their babies. In this video we are about to show you, you will see our team coordinating the transportation of personal protective equipments to the village of Bala and Sisua of Sankhwasaba. One Heart will go everywhere. We don't let rain, mudslides or COVID stop us. Now that you have seen the lengths that our team and courageous members of the community will go, I want to remind all of you that One Heart is still actively working on COVID response efforts to get equipment and services to people like Sunita and people in Bala and Sisua. Your donations have helped us achieve so much, and we from One Heart Nepal want to take this opportunity to say thank you for helping us continue to save lives.